What is COVID-19? COVID-19 is an incommunicable disease caused by the newest detected coronavirus. This new virus and disease was unknown before the outbreak began in Wuhan, China, in December 2019. COVID-19 may be a pandemic affecting many countries worldwide. What are the symptoms of COVID-19? The four most common symptoms of COVID-19 are fever, dry cough and fatigue. Other, less common symptoms which will affect some patients include pain, nasal congestion, headache, conjunctivitis, pharyngitis, diarrhea, loss of taste or smell, skin rash, or discoloration of the fingers or toes. These symptoms are usually mild and gradually begin. Some people become infected but have very mild symptoms. Most of the people, about 80%, get over the disease without having hospital treatment. About 1 in 5 people with COVID-19 have a severe illness and difficulty breathing. The elderly, and people with underlying medical problems like high vital sign, heart and lung problems, diabetes, or cancer, are more likely to develop a significant disease. However, anyone can catch COVID-19 and obtain seriously ill. People of all ages with fever or cough related to difficulty breathing, shortness of breath, pain, pressure, speech loss or movement should immediately seek medical attention. If possible, it's recommended that you simply contact a healthcare provider or facility. How COVID-19 spreads. People can capture COVID-19 from others with virus. The disease is primarily deployed from one person through small drops of nose or mouth, which is expelled when he sits or snakes or speaking someone affected by COVID-19. These drops are relatively heavy, and don't travel away and sink quickly on the bottom. People can capture COVID-19 if they acclaim these parts of an individual who features a virus. That's why it's important to urge far away from a minimum of 1 meter, far away from others. These drops can fall on things and surfaces around the person like tables, door handles and rails. People are often infected by touching this stuff or surfaces, then touching their eyes, nose or mouth. This is often why it's important to scrub your hands regularly with water or soap or cleaning it. The Planet Health Organization assesses this research on COVID-19 and can still exchange the updated results. What does self-isolation mean? Self-isolation is a crucial procedure taken by those that have COVID-19 symptoms to avoid injury to others in society, including relations. Self-isolation is when the one that suffers from fever or cough or other COVID-19 symptoms reception and doesn't attend work, school or public places. This will be voluntarily or on its own healthcare provider's recommendation. However, if you reside in a neighborhood of malaria or dengue, it's important to not ignore the symptoms of fever. Invite medical help. When he attends the clinic, the mask was born if possible. Occupy at least 1 meter distance from people and don't touch the surfaces together with your hands. If the kid is sick, the kid helps to stick to the present advice. If you are doing not sleep in a neighborhood of malaria or dengue, please do the following. If an individual is during a self-isolation, it's because it's a patient but isn't a severe patient, requires medical care, contains an outsized ventilated area with hands cleaner and toilet facilities. What am I able to do to guard myself and stop the spread of disease? Remember of the newest information on the outbreak of COVID-19, available on the WHO website and through the national and native public health. Most countries around the world have experienced COVID-19 cases and lots of them suffer from the outbreak of disease. The authorities in China and a few other countries have slowed outbreaks. However, things is unpredictable, so check regularly from the newest news. You'll reduce infection opportunities or publish COVID-19 by taking some simple precautions. Clean your hands regularly and fully using the hidden rub or wash it with water and soap. Why? Washing hands with soap and water or using rubbish with alcohol kill viruses which will get on your hands. Keep a minimum of 1 meter distance between you et al. Why? When someone or snakes or speaks it sprinkles small liquid drops of nose or mouth may contain an epidemic. If you're very soon, you'll breath in droplets, including COVID-19 virus if the person is infected with the disease. Avoid getting to crowded places. Not Finally, I say the time is best than the treatment, and peace be upon you and God's mercy and blessings.